Hello, everyone. My name is Jill Whelan and I'm from Deakin University, and I'm a member of Refresh, the Centre for Research Excellence in Food Retail Environments for Health. I'm going to talk you through the COACH framework today on behalf of all of my co-authors listed for you there on the screen. So COACH is the co-creation and evaluation of food environments to advance community health. So it has been designed to help retailers, customers, researchers, and all stakeholders who are engaged in the co-creation of healthier food retail environments to make change. It is a 4-phase continuous quality improvement process, which is listed there on the slide around identifying the challenge, communications policy alignment, co-design and monitoring. The numbers next to each of those points relate to your learning outcomes for this course. All of this work is depicted in a non-linear continuous quality improvement cycle. This is what the COACH framework looks like. It is purposefully colour-coded and non-linear to engage with the complexity of change in food retail environments to advance health. We know that it involves many stakeholders and many iterations and much flexibility and sharing of knowledge and skills to make this work actually be successful. So this is what we've attempted to do with this framework, to guide stakeholders through the process to get to a satisfactory and deserved outcome. How did we get to the COACH framework? Well, we did a systematic review of the co-creation literature around healthy food environments that was led by Carmen Vargas. And we did an evidence synthesis of the papers that the academics who work within Refresh and our colleagues have done around co-creation and healthy food retail environments. And we picked out the core elements in each of these 2 evidence synthesis reviews. We met across 12 researcher workshops and meetings to develop what we called a prototype of the COACH framework. And when we had it good enough to present to external stakeholders, we held 2 community-facing workshops for practitioners and researchers. And in those workshops, we were looking to explain and receive feedback on the COACH framework and the checklist we developed to help us through the COACH framework, and to improve the framework and the checklist to make sure that we were covering the core process elements that are required to work with food retail environments, and to provide the really practical guidance of how to do this work and what steps do you do and what are the ticks you need to do to make sure all boxes are covered and you are really going to embed change. COACH, as I said at the start, is a very non-linear process framework, and you can start wherever it suits you to start. I'm going to talk through the framework left to right, but if, for example, you are led by policy change, you'll see when we get to that phase, you could come in and start the work from that point. This green phase is around identifying the challenge that you are going to address. So that challenge could be product placement. It could be looking at reducing sugary sweetened beverages that are sold. Could be any number of things that relate to improving the healthiness of the food environment and therefore the health of the population. Usually in this work, we would undertake a baseline audit so that we know what it is we're measuring against, what things look like now, engage with multiple stakeholders across many areas of this work. So consumers, retailers, leaders, people in the food supply and logistics chain. There may be a role for government, there may be a role for researchers and for policy advocates. It's also really important early on to set up your governance and accountability structures to guide you through the strategic movement to a healthier food retail environment. This is an example of a tool that is really useful to help you in assessing that food store environment. And there are lots of different tools, and you can use whichever one is relevant and easy to use for you. This Store Scout app identifies 7 categories of food and drinks, and it gives you immediate feedback as scores across those categories, and it also suggests areas for improvement. So it is really cool. You can see Megan's email address at the bottom of that slide, and please contact Megan if you would like to know more. Another tool that's useful for baseline and follow-up assessment, as is Store Scout, is Healthy Diets ASAP, which is used to assess and compare and monitor the price differential and the affordability of healthy, which is the recommended diet, and the current, which is sadly largely unhealthy diets for most Australians. You can gain access to these Healthy Diets ASAP by contacting Merryn Lewis at the University of Queensland and undertaking some training to use that app. The app has really improved the usability of this tool by, when you enter the data, you press a lovely button called Calculate, and it does the difficult calculations before you, behind the scenes for you. I'd like next to talk about the orange cycle, which is communication and policy alignment. So this is when I said earlier, if you have a pre-existing policy, you may choose to start here. So one of the things that I'm working on at the moment, for example, is changes to health service cafes. So we do have in Victoria Healthy Choices policy guidelines for hospitals and health services. So this is where we enter our work, and we are spending a lot of time on the communication channels. But you'll notice always that there are all these links that are back out to the rest of the framework, so nothing can be done in isolation. It's really important to have a very strong communications plan across diverse media types, because you need to convey your message really clearly and really well to all of these stakeholders. The customers will be impacted by food retail changes, and the retailer, most importantly, will be impacted, and we need the retailers on board to advocate and share and celebrate this change. So we need strong, transparent communications at all stages. In the blue phase, we are focusing on broader community engagement to get to that co-design phase, where we're looking at what the problem is, what the context is, what's possible, and who does what. Many methods of co-design, which could be a focus group, could be a yarning circle, could be many types of things. One of the methods that I use a lot is community-based system dynamics and group model building, where we join together a group of stakeholders and ask for the factors that impact a problem, and we draw a causal loop diagram. On the next slide, this is systems thinking in community knowledge exchange, the software that we use for causal loop diagrams. And you'll see there, this is an example of something I've taken from a bigger causal loop diagram that looks at the factors that impact on a family's ability to eat well. The pink phase relates to monitoring and evaluation. When we're evaluating things, whatever they are, but particularly in food retail environments, we want to understand the process, those steps we took along the way from the beginning to the final outcome. We also want to know what strategies did we use in the implementation process. So did we engage with a champion, for example? Lots of details on how we did do the work. And then there's outcomes evaluation, which could be your sales data. Did sugar sweetened beverage sales be reduced? Did fruit and veggie sales increase? Whatever you are looking for with your particular project. FoodFox is an example of a really useful web-based platform that transforms sales data into visual reports, such as you can see here some examples. The store sales is uploaded, it's linked to a database of Australian dietary guidelines, and the report shows for each food group the number of serves purchased, the healthy and discretionary foods, and it can benchmark to other stores and to targets that can be set into the app of FoodFox. If you'd like to know more about FoodFox, please talk with Julie Brimblecombe about this. And that brings me to the end of Coach, but I want to just pause here for a little minute and remind you that this is continuous quality improvement. So although it's been a whirlwind tour of the many factors that are here, you're going to now discuss these in a little bit more detail in relation to a real world case study, and see if you can see and identify where these cycles fit into your own work and how you keep going. So once you've been through that once and you go back to the monitoring and evaluation, it feeds right back into multiple elements of the system, and you're back into identifying your next challenge and working through all of these cycles again. So thank you very much for listening. I hope you're enjoying the short course, and I hope you got something out of our talk today, and look forward to meeting you in person one day. Bye-bye.